Patients come to us with basically 3 or 4 different issues that lend us to believe that they really have significant problems with their legs. The first is a family history. A lot of patients come to us saying, my mother had this, my sister had this, my brother had it, my father had it, and the reason that their legs are heavy or painful probably is mostly related to their genetics in that situation. There are a couple of things that create the insufficient varicose vein. And when I say the insufficient varicose vein, most people remember from high school biology that the arteries are to take the blood out to the extremities and the veins are supposed to bring the blood back. Well, when the vein blood reverses and flows back down the leg instead of back up towards the heart, it's considered an insufficient vein. And so people get that for a couple of reasons, one of which is just their veins are loose or lax, and that can be a result of their genetics. 2 other significant reasons come about, especially in women and especially through pregnancy. Estrogen itself is a relaxing hormone which makes veins relax. Not only estrogen, but even some of the hormones produced by the placenta when you're pregnant also significantly relax almost all soft tissue structures like they do the pelvis to allow a baby to come out. That makes the vein relax too, and then the veins become looser. Not to mention the basketball that women carry around in their pelvis for a couple months that really presses on those veins. All those things add up to help make the veins further incompetent. And so those histories and the history of standing on your legs for a long time, and basically we live in a world with gravity, and the weight eventually over time results in the veins starting to fail. And so as people fail, their veins dilate, their legs get heavier, they start to get, it may be the first thing they see, they start to get spider veins in their ankles, and then they get bigger veins in their calves, and then big veins in the thigh. It's really, I like to compare it to a kind of an interstate highway backing up. If the interstate backs up, the on-roads and entry ramps to the interstate back up, and if that backs up, all the roads that are trying to get on the interstate back up as well. And that's kind of how the leg works. The interstate getting out of your leg is one of 2 major vein systems. The big one is the femoral vein, and the smaller one that is less important and in your skin is the saphenous vein. And that is really the vein that we are treating through vein closure. So our goal is to reverse the problems that's caused by the vein flow going backwards down your saphenous vein. There's a detour that the vein blood can take out of your leg. It can go from your saphenous system into your deep femoral system through what are known as perforators. And so your body can find a way for that blood to get out of your leg even if your saphenous vein has been closed from the inside. Our goal will be to talk with you and talk you through this and hopefully have you understand this process.